Hey everyone, this is Barbara Phillips with Nurse Practitioner Business Owner, and I thought I would make this video just going over some of the more common questions that we received during a recent webinar. It was held in January 2017, and it was about how do you start a practice. The webinar had more people registering than anything else we'd ever had, and it doubled the previous webinar. And people were locked out again for the second time in a row. So I thought I would just put up some questions about all of that. Now, for those of you that don't know me, I'm Barbara C. Phillips. For the past 10 years, I've been talking about how nurse practitioners and other clinicians can have their own practice, have their own business. And you'll find more information about a lot of this over at our blog at npbusiness.org. So let me go through these questions. Our first question is, can I collect cash from a Medicare patient who has an HMO, but the family decides to pay cash for the visit because they could not find a provider in the insurance network to see at the particular time of need for service? I am not in network with her HMO, but I am a Medicare provider. So here's the deal with Medicare patients and taking cash. In the Social Security Act, it mandates an eligible provider that includes nurse practitioners, whether you are credentialed with Medicare or not, that you must submit those bills to Medicare. If that family or patient turns around and submits the bill where they had paid you for cash to Medicare, you are liable to be fined, and you will have to refund the patient and then resend that in to Medicare. So it actually is against the rules and regulations, the law. So what you must do if you're going to take cash from a patient, from a Medicare recipient, you're going to need to opt out of Medicare. And then when you opt out of Medicare, you will need to enter into a private contract with the patient. So there's some posts about this at our blog at npbusiness.org. Plus, you can just Google opting out of Medicare and see what the rules are. But if you are an eligible provider, and that includes nurse practitioners, then you cannot just say, I am not a Medicare provider and bill the patient. Okay, I hope that helps and that makes it clear. I know we get a lot of questions about this. So if it's not clear, you can leave a comment on our blog about this below this video, and we'll see if we can help get that squared away for you. So our next question is, if you are a cash-only business, can you accept Medicare, Medicaid patients and have them pay cash, or is this illegal? So this kind of goes back to that first question on the Medicare. You have to opt out first, and you have to receive that opt-out letter from Medicare if you want to do this. Now, Medicaid and other insurance companies are different. You have to actually go to Medicaid, you have to go to the insurance companies, you have to get credentialed, you have to be accepted, they give you a contract, and you have to sign that contract. And of course, I hope you're negotiating in between there, but you have to sign that contract in order to be a provider on those panels. So in this case, for Medicaid or any of the other insurance companies, if you are not credentialed and contract with those companies, then yes, you can pay cash, or you can charge them cash. But otherwise, if it's a Medicare recipient, you must opt out first. So again, this is one of those things. It seems to be a little bit confusing. So if you do have any other questions, put them on the blog and we'll get back to you. So here's another question about billing with Medicare and Medicaid. How do you ensure that you do not run into fraud unintentionally? Are there any links or classes that Medicaid offers? So Medicaid is a state-run program, and each state will have different resources available for you. But let's look at documentation, which is really one of the biggest problems. So your documentation has to reflect the level of service that you're giving that person. So that when you go to bill out, and let's just use office visits here, if you're billing out a 99212, 213, 214, or the new patient codes, which are the 202, 203, 204, 205, if you're going to be billing those out or any of those codes, then your documentation has to meet certain requirements. And the gold standard is to look at either the 1995 or the 1997 documentation guidelines that CMS puts out. And you can just Google that. They're all over the place. You must follow one or the other. Now, alternatively, some things that you could look at is look at your state organizations and your state conferences as well as your national conferences. They will all have classes on documentation and coding for your visits. Additionally, there is a nurse practitioner, NP business consultants that actually do teach. Lynn Rapsilber, she teaches documentation for billing purposes. And there is a resource that I've used in the past and I send lots of people over to, and that's at emuniversity.com. So that's E as in valuation, M as in management, university.com. That's a physician who's a certified coder who actually teaches clinicians how to do their documentation to support their level of service. Okay, so you cannot code out a 99214 if your documentation doesn't reflect that. And don't be afraid of actually billing for the level of service that you provide as long as your documentation can support it. So there you are. Now, in terms of other fraud issues, there is intentional fraud issues that people certainly do, but I hope none of us are doing that. And that's things like billing for people that we never saw or providing services that we didn't provide. So as long as your documentation holds up to what you are billing out, you're going to be fine. Is it possible to obtain practice insurance to cover self-only professional liability insurance and business later? This person is having a hard time finding both. So here's the deal. If you are a practice owner and it's just you in the practice, obviously you have to have your professional liability insurance. That is separate from your business insurance. Your business liability insurance, that's that slip and fall, fire and disaster type of policy. Some of the liability companies, professional liability insurances, are adding that on. Some are not. You can go to any local insurance broker in your community, such as a Farmers, a State Farm, whatever, and talk to them about getting liability insurance for your office. Now, I also want to throw in here that if you are practicing and you have an assistant, you have some kind of clinical assistant, not your receptionist, but somebody in the back office who is doing things with patients, then you will have to cover that individual as well, whether it's a CMA, a CNA, whoever, another provider, whatever. You're going to have to make sure that there is coverage available for them as well. So again, and the other thing too, let me throw this in here. When you say later, most places when you are renting or leasing your space, they want you to have some kind of business liability insurance to protect yourself and also to protect them. So hopefully that helps. Do you have any recommendations on how to find a CPA and an attorney? So here's the deal. I don't. You have to look in your local community to find a CPA and an attorney to work with. Now, attorneys, of course, are limited by wherever they are barred. So one of the recommendations that I often give is to just Google the American Association of Nurse Attorneys. That's what it is. And you can get a referral from one of those nurse practitioners who happen to be attorneys. But bottom line with any of this is start asking your colleagues. You want somebody who is local, who is also going to be able to, who understands healthcare, They understand your role as a nurse practitioner. The CPA should also understand about small business and hopefully healthcare practices. And I'm glad you asked this question because it's really important to have these people on your team. This is one of the things that we talk about in our course is just making sure that people have the proper professionals on their team, because being in practice, being in business, it's not a solo event. You have to have a team behind you. So what's better, an LLC, a PLLC, an S-Corp, or a C-Corp? Well, that's a question that has a couple of different requirements. First of all, what does your state say? In some states, if you're looking at an LLC versus a PLLC, in some states, your state will mandate that you as a professional may have to have the PLLC. So let me just step back for those of you that aren't familiar with these terms. An LLC is a limited liability corporation. A PLLC is a professional limited liability corporation. An S-Corp is something that you can elect. Once you're an LLC or a PLLC, you can also then further elect that S-Corp. And a C-Corp is what we think of when we think of large corporations. Your CPA will help you with this to determine what is best for you. It happens to be closely tied into taxes, and that's where your CPA comes in. Your CPA, you want them to be able to advise you about what is best for you tax-wise, and this is where these corporate structures often come in. So definitely talk with your CPA about this. I will be 60 years old. Is it worth the time and effort? This is a very good question, because when we think about it, and if you're 60 now, I'm going to assume that when you were a child, 60 was a heck of a lot older than it is now. So the question becomes, what are your goals? What is it that you want to do? How much longer do you intend to work? For many baby boomers, which I am one of, working for the next 20 years is something that is not outside of what's been reasonable for all of us. Many of us will continue to work in some capacity or another. So it's up to you. And this is one of the things that we talk about in the very first module of our course, is really taking a look at your goals, your desires, how you want to get into business, how you want to get out of business. What are you going to do with your business when you're done? So it's really important to take a look at this. The other part of this is there are plenty of us that are out there that have transitioned into other kinds of practices that we consider our retirement practices. We have no intention of stopping the work that we're doing, but perhaps we've scaled back or we've done something a little bit different. So you want to consider that as well. But personally, I don't think 60 years is too old. It just depends on what kind of a practice that you want to do and what your goals and desires are. So that's really a very personal question, but I think it's a very good one. Is there a manual for the step-by-step process to starting a clinic? I don't know of a manual. I think our course comes close to that, where we actually take you kind of A through Z to what do you need to do to start a practice, starting with your goals and all the research that you need to do, everything that you need to do to put that business plan into place, all the stuff that you need so that you can start plugging in the holes of a business plan, to how do you market your clinic? How do you manage your staff? What's all the operational stuff? What's all the billing and credentialing and the compliance parts to having a business and a practice? So again, I don't think that there's a complete manual for step-by-step, step 1, step 2, step 3. The other thing that I'll say is when you are doing step 1, step 2, step 3, there's a lot of things that have to be done simultaneously. So I personally don't approach it as a step 1, step 2, step 3. I approach it as here's, 7 areas to be focusing on while you might be doing different things out of the different parts. So hopefully that helps a little bit. Credentialing with CMS is a very painful process. Agencies that do this charge a lot of money. Any suggestions? Yes, the agencies that do this, they do charge a lot of money for credentialing, not with just CMS, but generally others. And the problem is I hear back from a lot of nurse practitioners, and obviously this isn't all agencies and all companies that will do this, but I hear back from enough people that it has me a little bit worried, where somebody started their credentialing, they paid a good chunk of money, and then things aren't happening. They can't get a call back from them. They don't know where everything is. In fact, that came up recently where somebody had to really start all over again. Credentialing is not difficult to do. It is very time-consuming and it's tedious. The good thing is when you are in the beginning of your practice, you usually have more time than money, and so you can do this yourself. And many, many, many of us have done the credentialing ourselves and didn't hire it out. And this is one of the things that we talk about in the course is just how do you do that credentialing? And how do you keep track of all of that? And how do you do the follow-up? And what are some of the different tools that you can use? So yes, you can do the credentialing yourself. And I would really think about doing it yourself. It's not hard. We just need to get over that idea that it's hard. But, you just have to keep track of everything. And remember, it is tedious. So that's the end of the questions that I'm going to go through in this short video. But I did want to tell you, because a lot of people, I've had a lot of emails already asking me about the course. At the time that you're watching this, it may or may not be available. If it is available, you'll find it at clinicianbusinessinstitute.com. And if it's not available, it will be released later in the spring or at whatever time you're watching this. So we take it down periodically in order to really focus on the people who are in the course and to tweak the course a little bit more. If you're interested in more information, you'll see on this page is a mind map that goes over what you need to do to start a practice. And so you can find that mind map over at our blog at npbusiness.org. And you can just sign up for the mind map and it'll be sent to your inbox where you can get it. So very easy. It's free. There's no cost for that. And while you're at the blog, that blog has been published for over 10 years now. So take a look around. You'll find a lot of information on business and nurse practitioners. If you have any other questions, please leave them on our blog below this video. And I wish you the best, and we'll see you soon in another video. Bye-bye now.